Hello, I am making a video today to talk to you about functional reflex therapy. I'm running a workshop for functional reflex therapy, or FRT, this Thursday and next Thursday at the Salvation Army Hall in Wokingham. So that's this Thursday the 16th and next Thursday the 22nd of June. And it's quite a difficult thing to explain in writing, so I thought I'd make a video. I'm borrowing my lovely son's feet here, which are quite big and hairy. FRT is normally used on children, but it can be used on anybody. So briefly, FRT is a very super simplified form of reflexology. It was developed by Lorraine Senior, who's a reflexologist and a teacher, and has worked with children with special needs for some 20 years, and wanted to develop something that parents and carers could use at home on their own children. And it's one of the things I really like about it is, instead of having to always defer to a therapist, it gives parents and carers something that they can do to help their children. So FRT is done on the feet or on the hands. I'm just going to show you very quickly a very few techniques on the feet, just so you get an idea of what's involved, because people think because it's reflexology it's going to be complicated, and it's really super simple and lovely, and it's a really nice treatment to give as well as a really nice treatment to receive. So although it's developed for children with special needs, autism, Asperger's, developmental disorders, ADHD, things like that, it can be used for anybody. So you could learn it to use on a child with special needs, but you can use it on anybody else in the family. So it helps with relaxation, it helps to improve mood, it helps to reduce anxiety, it helps to support well-being generally. It's very good to help people to get back to sleep as well. So if you've got a child who doesn't sleep or can't relax, it's really useful for that. So when you come along to a workshop, the workshops are over 2 weeks. The first week is an introduction of the techniques and how to apply it, and beginnings of learning how to do it on the feet. And the second week is how to apply it for the hands, and a revisit of how to do it on the feet. And when you come along to a workshop, you get a little rucksack like this that you can keep all your equipment in, a towel, and we can have cards that show hand reflexology or foot reflexology, and functional reflex therapy, so that if you have a child who is non-verbal, they can explain what they want, and you can explain what you're going to offer. So get a little bag with all those in, and then I give you laminated handouts as well of the routines, so that you go away knowing exactly what it is you're going to do. So just really simply, the routine is based on the rainbow. So we do, this is my bar. People who know me know that I make this particularly for reflexologists, really lovely. It might be a bit strong smelling if you have a child who is sensitive to smells, but it is lovely. But you can use anything or nothing, so it's just something really to make the feet slippery, and then there's less pressure on your hands. But you can use a bit of hand cream, or you can just do it dry. You don't necessarily need to use anything at all. So we start off by doing a squeeze on the solar plexus area on the soles of the feet, which is also kidney 1 for any acupuncturists out there. And that helps just to calm and centre the body. And then between each movement we do a lovely sweep up the legs, which you won't be able to see on the video because it stops past the feet, but that's what we're doing. We're doing a nice sweep of the legs. And then each movement is really simple to learn and simple to follow, and like I say, you get a handout with every one so that you know exactly what you're doing. So if you want to come along, as a couple or as a pair, I would offer a bit of a discount if you book together. If you come on your own, then you will have somebody else to work with, but be prepared to touch strangers' feet. But I touch people's feet all day, every day, and I love it, so I promise it isn't as bad as you think it might be. I've got baby wipes and balm and all sorts of things, and it should be fun and it should be interesting, and it gives you a tool that you can use and apply yourself at home for your children. So any questions at all, drop me an email, drop me a private message, or send me a text, and I look forward to seeing you. Thank you. Bye bye.